35%. That's how many independent pharmacies have closed their doors in Minnesota over the last 6 years.
Look, pharmacists are the most accessible healthcare professionals in America.
From mom and pop independents to big chain drugstores, this trend has a serious impact on healthcare across the country.
As of 2020, about 25% of the United States was a pharmacy desert. And we have every reason to expect that number to have only grown.
Independent pharmacies say they're being driven out of business by big corporations.
In the last part of our series on the state of American pharmacies, we look deep into the world of pharmacy benefit managers. In our third and final part, we're going to dig into how pharmacy closures affect healthcare.
You're seeing independent pharmacies just disappear across the country. They've vanished by the hundreds. And even some of the chain retail stores, CVS, Walgreens, Rite Aid, many of them are closing as well too.
Roughly 1/3 of the nation's pharmacies have closed their doors since 2010, according to research from USC and UC Berkeley.
If we keep closing these pharmacies, particularly in the rural areas, that accessibility to healthcare is going to suffer. And, whether you're Republican, a Democrat, or independent, we all want the same thing. We want accessible, affordable, quality healthcare.
Depending on where you live, it may still be pretty easy to find a pharmacy, but other places where you live, it's becoming very difficult simply to get a prescription filled. We call those pharmacy deserts, and the pharmacy deserts in the United States are expanding. So more and more patients are finding it difficult to get that prescription filled.
Nearly half of all counties in the U.S. have at least one pharmacy desert, according to research from Ohio State University Comprehensive Cancer Center. They define a pharmacy desert as a 10-mile area that contains no retail pharmacy. There's no one definition of a pharmacy desert. In fact, Hoey says there are a number of factors that can contribute to that portion of healthcare access.
You could have a pharmacy 2 miles away, which for most people that's pretty close. But if you don't have a vehicle, or you don't have, or you don't walk well, you have a difficulty walking, 2 miles might as well be 100 miles. So they look at things like vehicle ownership. They look at not just distance away as the crow flies, but maybe there's an interstate between you and that 2 miles. Maybe there's a mountain between it.
We're increasingly creating a country with more and more medical deserts, and that includes a big portion of rural America, as well as urban areas, poorer neighborhoods in big cities.
The solution to pharmacy desert concerns goes back to part 2 of the series. In March, Alabama's House and Senate unanimously passed the Community Pharmacy Relief Act. It aims to curb the influence of pharmacy benefit managers by making sure they pay pharmacies no less than Medicaid.
We need oversight of PBMs.
If we are able to do something about PBMs, they're just going to make up for it somewhere else. That's why we've got to have, we've got to break these up, bust them up.
If these companies were busted up, we would see, I think, some change, because it wouldn't be feeding this monster in the way that it is now.
We need Congress to take action with the 2 biggest programs in pharmacy. One is Medicare, and one is Medicaid. And largely, the federal government has turned Medicare and Medicaid over to PBMs to run. Since they've done that, drug prices have skyrocketed, profitability of these companies has gone higher, and the burden on taxpayers has gone up. The Medicare program, the Part D as in David, Medicare program is run by the PBMs. The federal government turned over the program to the PBMs.
For now, PBM reform is shelved in the halls of the United States Capitol after it was omitted from the latest budget package. But 39 states' attorneys general have called on Congress to pass legislation similar to that of Arkansas, which banned PBMs from owning pharmacies in the state. I'm Ray Bogan for Straight Arrow News. For more reporting, download the SAN app.